Do you recommend annual eye exam for
Sure.
kids?
The eye exam should be done at birth,
At birth?
because there could be certain congenital anomalies that a child could be born. One of the common is watering. There could be a NLD block, a block of the from where the fluid goes from the eye inside. There could be some malformations, etc. Then you have to do a test maybe after 1 year, then before school, before a person enters school, and then every year.
Every year.
Yeah.
Dilated exam or not?
See,
Because
when
the
you're
reason I'm
looking-
asking is I have 2 little kids. I took them to the ophthalmologist.
Yeah.
As soon as they said dilation, they get screamed. My kids.
So kids are at times not very cooperative.
Yes.
But if your child has myopia, then a retinal examination is required. So actually, a total examination, even the front surface of the cornea, there are certain diseases like keratoconus, etc., which can develop at the time of puberty. So you need a comprehensive examination. A dilated examination. Nowadays, we also have non-mediatic fundus cameras. That means that you can take the picture of the retina without actually a good dilatation being required. But if a child has a power, then the first time around that you're doing, you need to do dilatation is not the issue. It is called as cycloplegia. What that means is that we just talked about the ciliary muscles. You need to relax that by putting eye drops so that the correct power comes. A child has very strong power of accommodation. That means that the child can change the focus of the lens. So you get a false induced myopia when you're checking on these computerized machines. So that is something important, that you need to have a cycloplegic refraction the first time around when a child is doing, and more so if the child is having a plus power.
A small tip that I use for my kids is, you cannot avoid screen time completely.
Yes.
I always do this one hand distance.
Okay.
Is that okay?
No, that's fine. There are a couple of things that you have to do. You see, you have to understand when you're doing the screen, first thing is you do a partial blink. You don't blink, open blink. So that's a partial blink. So that gives rise to scratchy, irritable red eyes by the time. Then you are moving your eye constantly. The screen often is pixelated, the image that comes. So you have to kind of focus and kind of get the image that is there. So that again gives you the strain. So what is important is called as the 20-20-20 rule. So after 20 minutes of screen time, you need to look at a distance of 20 feet, take a rest for about 20 seconds and give about 20 blinks. So that's something that helps. Apart from that, obviously the hygiene, outside activities, then you need to look at green leafy vegetables, which the children don't like, and you look at the fruits, etc., mangoes, etc., that is there.
Follow Center for Sight and post your queries to get answers from the experts.